So we already discussed about the molecular pathogenesis and the risk factors associated with the colorectal cancer. Now in this section, let's discuss some of the primary prevention steps for the colorectal cancer, then some screening measures or screening methods which are effective for the diagnosis of colorectal cancer, and then also how these cancers present or what are the clinical features of the colorectal cancer. So the primary prevention, we have orally administered compounds in the primary prevention. Then we have chemo preventive agents like aspirin. Aspirin use is helpful in the prevention of the colon cancer, so it's also primary preventive medicine. Then non-steroid anti-inflammatory drugs, ibuprofen, these are also helpful and effective in the primary prevention of the colorectal cancer. Oral folic acid supplements are effective and they are used as primary preventive method for the colorectal cancer. Oral calcium supplements, and then estrogen replacement therapy. So all these are the primary preventive measurements for the treatment of the colorectal cancer, and these are some of very commonly used drugs or compounds also. So calcium supplements, folic acid supplements, the aspirin, non-steroid anti-inflammatory drug, and the estrogen replacement therapy. All these are effective in the prevention of the colorectal cancer. Screening methods, we have proctosigmoidoscopy, especially after the age of the 50, colonoscopy and proctosigmoidoscopy, they are recommended as the normal medical care or the normal screening test done in the especially the Western world or in the advanced countries. So proper screening for the diagnosis is very, very helpful in the early diagnosis. If there is any bleeding from per rectum or there is bloody stools, that also should be followed up properly. So these are the methods that help in the early detection or the early finding of the colon cancer. So procto is for the rectum, proctosigmoidoscopy, examination of the rectum and the sigmoid colon. Digital rectal exam per rectum, PR, is usually should be done as a part of the routine annual medical checkup, and if there is any blood or if any mass felt on the manual examination, digital examination, this index finger is used for the digital rectal exam. And the patient should be in the same lateral position. Same lateral is the position in which the patient is on the left side with the left leg straight and right bending at the knee. Usually the same lateral position is used for the rectal examination, or the knee chest position is the other position in which the patient is bending over, that is used for the rectal examination. So that's the digital rectal examination. So stool testing is another, especially for the occult blood testing. Occult blood slides are given, and then these are the slides. Sometimes the doctor give the patient the slides so they can do the test at home, or it can be done as a rapid test in the clinic. And for the occult, it's called the occult test, and this is a slide with the patient's specimen is put on the slide, and then it flips over, and then occult blood testing serum is placed on the other side. If it turns blue, it's positive for the blood. So it's for the occult blood testing. So stool testing is also very effective, especially in the old age. If the patient is becoming anemic and there is weakness and there is dizziness and no cause is known, then occult blood test is the test should be done to find out if there is any problem there. So it's already occult blood test. Then we have fecal DNA testing, and then the contrast barium enema is done for the screening. Also, some other methods for the screening or this test for the screening, we have the colonography, in which the picture is taken of the colon. Graphy is the recording. So colonography recording is performed. Then we have flexible sigmoidoscopy. Flexible sigmoidoscope is inserted, and then the examination is performed inside, and if there is any mass or swelling, that can be examined or visualized. Colonoscopy is examination of the colon. And then we have polypectomy or biopsy. It's important that on the sigmoidoscopy, on the colonoscopy, if there are any masses or swellings present, we should do the biopsy, or we should remove that polyps, and the biopsy should be performed to find out if they have any malignant changes or malignant transformation that can. So it should be diagnosed early and treated. Clinical features of the cancer, usually we have the stool is relatively liquid. Sometimes we have blood in the stools also. Ulcerations are present, and these ulcerations you can see on the colonoscopy or the sigmoidoscopy. So these ulcerations are the signs present. There are ulcers present. There is fatigue, and then there is palpitations because of the fatigue, tiredness, weight loss, loss of blood in these stools. There is fatigue and palpitation because all these leads to the decreased supply of oxygen, decreased level of hemoglobin, and this weakness can cause palpitations, which is the awareness of the heart. Palpitation is actually the term used when there is awareness of the heart and patient can feel their own heartbeat. So fatigue and palpitations are present. Then there is angina pectoris. This angina is also because of decreased supply of oxygen, anemia, decreased hemoglobin. This is the chest pain that is due to decreased supply of oxygen to the heart muscle. Hypochromic microcytic anemia. Anemia is present. The cause is the same, blood loss, and all the features associated with anemia are also present. Then we have apple core or napkin ring lesions. Napkin ring, apple core, there are on the examinations, on the graphy, clonography, sigmoidography. On the pictures you see there is the narrowing of the colon is present, or there are lesions which cause stenosis or the narrowing. These are also present. And then hemorrhoids. Hemorrhoids are the dilated veins, rectal veins. Hemorrhoids are dilated rectal veins which are present as a result of the pressure changes present, and this hemorrhoids also associated with the bleeding per rectum, and the maybe internal hemorrhoids which are situated internally, not visible outside, or they may be external hemorrhoids. Serious complications can occur as a result of the hemorrhoids, like ligation of the hemorrhoid. That's emergency and should be treated in emergency. So all these are the presenting symptoms associated with the cancer. So this was all about our section, primary prevention and the screening. Thank you for watching sqadia.com.